What's going on, everybody? Welcome to the Health is Hard podcast. I'm your host, Dr. Matt Eichler, and I'm here to help you cut through the noise and find the strategies that actually work for building a stronger, healthier, more resilient you. As a seasoned chiropractor, fitness junkie, and founder of Element X Health and Fitness, I've seen firsthand how confusing and overwhelming the health and fitness landscape can be. That's why I've made it my mission to simplify complex concepts, bust myths, and provide you with actionable tips you can start using today. Each week, we'll dive into topics like optimizing movement, building muscle, bouncing back from injuries, managing pain, managing your mindset, and so much more. Whether you're looking to level up your nutrition game, fine-tune your fitness routine, or just feel better in your own skin, Health is Hard is here for it. I'll do my best to make even the most challenging topics engaging and relatable. I'm hoping you'll be learning, laughing, and leveling up your health every episode. All right, let's dive in. Let the brain gains begin. Remember, the information/opinions provided in these podcasts/videos is/are for entertainment and educational purposes only, and is not intended as a substitute for professional medical advice, diagnosis, or treatment.
What's happening, people? I am so excited to finally be doing this. Welcome to the Health is Hard podcast. I'm the host, Dr. Matt Eichler. It's been a long time coming. I've been talking about doing this for a while, but now we're finally here. So I'm not going to be good at it right away, so I'm just going to embrace the imperfection. I am a perfectionist, so I'm going to try to just do my best, and we'll get better over time. So, this episode, we're going to talk about, this is the introductory episode, so I'm going to tell you a little bit about my story. I'm going to tell you a little bit about how I've gotten to where I am. And really just kind of explain to you how I went from a young athlete with an injury-riddled career that thought I had no choice but to do something in the world of sports to evolving all the way into what I'm calling a doctor of the future. So we're going to jump right into it. First thing I want to start with is a quote by a really smart guy. You might recognize his name. It goes, "The doctor of the future will give no medicine, but instead will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease." And if you had to guess, you would probably not say that that was Thomas Edison. We're going to talk a little bit about kind of my small town roots here first. And I grew up in a tiny little town in southwest, kind of just southern Michigan. And I was a standout athlete, like right away. I had a lot of talent right away. I was able to, put a lot of work in, and I'm going to explain that. But I grew up playing sports. I really was constantly on a basketball court or playing some backyard football, or was always trying to be active and just loved the thrill of sports. Like, I realized that I had some potential, but I didn't have any idea how much. So, I was probably in 7th, 8th grade before I realized, okay, I'm decent at some of these things, but that's right when I got super motivated to start putting the work in. So I remember that we had this program at our high school called BFS, Bigger, Faster, Stronger. I think it was kind of sweeping the nation at the time, and it was one of those things where, it was basically programmed exercise for high school athletes to clearly make them bigger, faster, and stronger. But I started hitting that hard, I think 6th, 7th grade even. I started lifting weights. I would have been 12, 13 years old. So it was like I started early. I could dunk a basketball in 8th grade. I remember I was about 5'9", probably 145, 150, and I could dunk a basketball with two hands in the 8th grade. And I'm not trying to really toot my horn, but I just want to explain, kind of set the stage for what I went through so you understand why I have some of the interests and how my story kind of played out. So my freshman year of high school is when I really transitioned from thinking I was going to be a basketball player to realizing that football was my thing. So my freshman year of high school, I was pulled up to the varsity to play cornerback, mostly just defense. I remember the first game I tied the team for solo tackles as a cornerback. I had like 8 solo tackles. And then the second game got interesting. So we ran this wing tee offense where, you had 3 running backs, pretty much fullback, 2 halfbacks, and basically it was just misdirection. Everybody was going crazy. You were just trying to hide the ball. And we had 2 halfbacks that were like juniors and seniors, and I was a freshman, right? But I think I was the first backup halfback. And one of my best friends went down. He was one of the starters, and he went down with an ankle injury in the second game of the season. And it was kind of like, you're up. So I laced him up. I was planning on just playing cornerback that game, but sure enough, I stepped into his spot, and basically my second or third run of the game was like a 45-yard touchdown. And then that was followed up by 3 or 4 more. I ended up having 5 touchdowns in this game on 8 carries, 198 yards. I only got tackled twice. And I was happy about that, considering I was undersized. I was just out there running scared, right? But we had a great offensive line. We weren't playing a great team, and they were able to make huge holes, and I was able to take advantage. So 5 touchdowns, 198 yards on 8 carries, 25 yards a carry, roughly. So, there was a big write-up in the paper about this. They were calling me the freshman phenom, when really I didn't really even realize that I had that kind of potential. So right away, I already had the interests of all the coaches in the area. Everybody was like, whoa, this kid can play. And I didn't even realize I could play. So, it was one of those things where I was like, oh, I had to kind of almost go through that. And then it fueled my motivation to keep training and to push and just really to go hard in the gym. And I was like, holy cow, I've got some potential. I didn't even think I could play college football. I really had no idea. And once that happened, and then, I realized it wasn't a fluke. Second game after that, I had like 3 touchdowns. Game after that, it just ended up spiraling out of control not out of control, but in a good way, until I had an injury like the second to last game. I think I fractured my ankle. So I was out the last game, but I ended up, basically finishing the season with pretty decent numbers as a freshman, right? So nobody was expecting that. Neither was I. So after that, I got really super motivated. I'm not trying to toot my own horn. It's just a fun story, and I love football. So, I basically, after that, went on to stand out in 3 different sports. I played basketball, football, and I ran track. And I just had some wheels. I was fast, but I was training. I was training hard. To try to best my times and my skills. And I said, hey, if I can actually do this, I'm gonna go whole hog into it and really play at the best of my ability. And I really got fascinated with this ability that you can train yourself and improve. Of course, at that time there's hormones involved and all kinds of things, and my body's developing in different ways, and it was amazing to see what I could do through training. So that was kind of like my first epiphany, was like, oh my gosh, there's this physical growth potential that everybody has. And it instilled in me this physical growth mindset. And I was like, man, you could not be very gifted. Now I feel like I did have, some genetic gifts, and I was talented from the get-go, but I trained hard, and I realized how much I could benefit and how much I could improve via the training. So I got addicted to it. I got super addicted to it, and just, it became one of those things where I was in the gym all the time. I was the first in there, last to leave type of thing. And all my friends at home will attest to this. I was always in there. I started strength training when I was probably, like I said, 12, 13. So I'm 35 now. So it's been over 20 years that I've been in the gym. So despite an injury-plagued career, I had some pretty wild successes. I was a state champion sprinter as a junior in high school, and I won the 100-meter dash in my division. And it was just, it was a fun ride until a pretty gnarly injury brought everything down. So I ended up tearing both hamstrings in the same year, and wasn't able to repeat my success. It kind of came crumbling down. And at this time, everybody's recruiting me, and I had recruits from all different schools that I never even thought would ever be interested in me. Hardly anybody from my school ever got recruited out of that area to go play at some of these schools, like in the Big Ten and in the MAC conference, the Mid-American Conference up there with Central Michigan, Western Michigan, Toledo, Ohio, Miami, Ohio, all those schools. Once those injuries kind of settled in, it really messed with me. I really just, I really didn't know what to do other than that. I knew I was pretty smart, but I just gotten good grades because I was trying to stay on the field type of thing. So, I went through that whole epiphany of, man, you can work hard, but you also can have it taken away from you, and it's not even your fault. Well, I guess I probably could trace it back to being my fault with the way that I was training and the lack of coaching and all that kind of thing. But, I'm not blaming anybody. It was definitely one of those things where once that happened, all these recruiting offers almost just went away. it was unreal. I had multiple coaches calling me every week, and basically it was checking on me all the time to almost nothing. And I didn't hear anything from anybody. So I got kind of depressed, and I thought I was damaged goods, and I thought I'd go to a smaller school and try to transfer out. But long story short, I ended up going to Saginaw Valley State University, where I ended up doing my bachelor's degree. And while I was there, I was supposed to do the walk-on football tryout, and I re-tore a hamstring a couple days before that. So basically, I was like, I'm so sick of being injured that I kind of gave up on it. I wish I wouldn't have. I wish I would have hung in there and stuck it out, but I was so sick of rehabbing. It was like 2.5 years of rehab at that point. I was sick of it. I said, hey, let's focus on school. Let's see what I can do academically. And that's when I really realized that staying in the gym is what kept me sane and to help me deal with a lot of the depression and just a lot of just that athletic void that now was there. And I'd put so much into my identity of being an athlete that once I wasn't anymore, it really messed me up. So I started to put my dedication into things like bodybuilding and tried to just like stay in the gym to fill that void. But then academically didn't know where my potential was and just had to kind of figure out what my potential was there. So I started doing some different classes. I think I was, like a physical therapy, pre-physical therapy, and exercise science major. I started doing some of the pre-med, prereqs, just wanting to keep that door open. And finally, I had some success academically, and I was like, well, maybe I'm a little smarter than I thought I was. So I started to develop a little bit more of that same growth mindset that I had physically, that I realized, hey, if I train, I put the work in, that I can improve. That holy cow, I can do this mentally as well. And I thought I was kind of just like a dumb jock. I really did, but then I got into some like chemistry classes, organic chemistry and all those things. And I excelled, I crushed it. And I was actually interested in it. And I was like, holy cow. Basically, long story short, I was going to medical school. I was like, I'm going to be an orthopedic surgeon. I'm going to ball out. I'm going to be some, super stud surgeon, screw athletics. I'm just going to focus on academics and just make a heck of a life for myself that way. So as things went on, I think the two lessons that I'd kind of learned to this point, and they were kind of epiphanies for me, were these growth mindsets. You really can do anything if you put your mind to it. I know it sounds cliche, but if you put the work in, sky's the limit. So probably the most valuable lesson I learned in my entire early life, honestly, is just this open-minded growth mindset where you can do whatever you want to do. While I was in undergraduate college, I started working at a GNC. It just naturally kind of fell in my lap. I knew some of the managers and whatnot, and I trained with them here and there. And I started to just become fascinated with supplements and biochemistry and nutrition, and how can I further improve my body or my physique or even my mental health or my mental acuity with supplementation or nutrition. So it just lit this fire under me to want to learn, and this curiosity just went crazy. So I ended up deciding not to go to medical school. I ended up falling into this situation where I thought about chiropractic. And I was like, oh, shoot, I'd always gone to chiropractors. I just never really considered being one. But I was playing on some intramural sports teams that a chiropractor or two, I think it was a partnership that was sponsoring. And he ended up kind of talking me into it a little bit. He was like, hey, just swing by my office. I want you to check it out. I know you're thinking about medical school, but this is a lot like medicine, just, more holistic, more versatile as far as how you can do it. You can work with exercise and nutrition, and you can help people a number of different ways. The adjustments and whatnot are our modality of choice, but we help people a number of different ways. So sure enough, I checked it out. First adjustment I ever saw was a lady limped in with kind of a bum ankle. I don't know why. We didn't even know what was going on. The doc that I was shadowing checked it out a little bit, did some tests, didn't think it was fractured, and decided he was going to adjust it. He was going to manipulate the ankle. It was amazing. The first time I had actually observed adjustment, when I wasn't on the receiving end of it, this guy basically took this lady's ankle, gave it a weird little maneuver, and then gave it a big pull, and she started bawling. And we were both kind of like looking at each other like, and she started bawling because she just put pressure on it and it didn't hurt. She limped into the office and he moved that thing around and she walked out of that office almost 100%. Now that doesn't always happen. Don't get me wrong. I've been a chiropractor for almost 10 years now and that doesn't happen. It does happen, but it doesn't happen every time. And it's not a guarantee that that's going to happen for anybody. But it did. And it really made me think, holy cow, that was cool. And I was really impressed with just the nature of what that did for her and how easy that was for that doc to do. And I was just like blown away by it. So it just really fit my values and the versatility of chiropractic and how to kind of holistically manage a patient from a number of different avenues. So I was like, boom, going to chiropractic college, came down to Florida, and further kind of fueled my obsession with biochemistry and nutrition and bodybuilding, and decided I was going to compete. Decided I wanted to compete in bodybuilding. I competed in men's physique, I think only the first or second year. It was like 2011, first or second year that it was a thing. So the men's physique is it's not bodybuilding, but it is bodybuilding. It's where they wear the board shorts and the like, almost looks like a fitness model / swim trunks kind of look, like a beach body type of look. And I was like, all right, I can do that. 2 shows in undergraduate or in chiropractic college as I was studying, and then did another one afterwards. But we'll talk more about that later. By the time I got to end of chiropractic school, of course, chiropractic school is more grueling than most people think it is. It's not easy. It's a full-time job. We go over all the basic sciences. It's not easy at all. People sometimes think that chiropractic is just like a 2-year additional degree or something, and it's like a master's or something. No, it's a full-blown doctorate. And I would say that the musculoskeletal portion and the spinal anatomy and neurology and whatnot is right up there with probably a specialist in those areas, like a neurologist or even like a neurosurgeon. So, of course, we don't get like the public health type stuff and the pharmacology, and chiropractors have no pharmacology rights or anything like that. So, what's lacking there, we make up for in the musculoskeletal portion of things. I excelled. I never failed a single class. I never failed a single board exam. I kind of skated right through chiropractic school, but it was because I put in the work. I was willing to hustle. I would overstudy. I was one of those guys that was going to be prepared. Now, sure, I bombed some tests here and there, but I never failed a single class. Upperclassmen that were retaking their boards 2 years, basically when I was taking my boards, the kids that were 2 years ahead of me sometimes were still taking theirs. So it's not easy. It's not easy. But by the time I got to end of chiropractic school, I really had realized a couple things. One, my growth mindset was fueled even more by learning more, but getting in a different environment down in Daytona Beach, Florida, around a lot of money and just beauty. And I really was just exposed to so many things that I still to this day say that the most important thing I learned in chiropractic school was this curiosity and hunger for the abundance that's out there. So I'm not sure if I would have got that if I would have went somewhere else that was less beautiful than Daytona Beach, Florida. And I ended up getting to live on the beach while I was there. So I got super lucky with that. So that was awesome. Lived on the beach, basically ocean view every room in my condo, almost the whole 3 years I was there, 3.5. So anyways, a weird thing happened towards the end of chiropractic college. They call it the Dunning-Kruger effect. So the Dunning-Kruger effect basically is where the more you learn, the more you realize you don't know. So I felt as if I had learned a ton, but I didn't know enough. This wave of insecurity brushed over me and stayed. And all of a sudden now, that combined with a bunch of emotionally traumatic experiences and whatnot, I felt horrible, especially coming out of chiropractic school. I should be at living life high at the peak of my, achievements. I was going to graduate as a doctor, but I felt like I knew nothing. So I pounded the books. I was learning, I'm doing clinical rounds, and then I'm doing my internship and all these things. And I'm actually treating people, but I feel like I know almost nothing, which is kind of unbelievable. But there's some things that led to that some kind of publicly humiliating experiences and whatnot that made me really just feel very small And, going back to those probably shouldn't have affected me the way that they did, but they did. But I would take it as a kind of a gift because it made me just go hard as far as learning all the things I knew I needed to learn and just start diving into everything. And I think I learned more in the year coming out of chiropractic college than I did the whole time I was there. And the whole time I was there, I was just memorizing stuff and understanding clinical application and passing tests and getting the grades and trying to get out of there, trying to get that piece of paper that said I was a doctor. But the first couple of years of practice is where all the learning happened. And I'm telling you, I would go to my clinic that I was working in, and I would do my thing, see people, do what I could for the offices that I was working in. And then I would come home and I would literally pop on YouTube, open a book, and I would study all night long. And then I would do the morning routines and I would do this, I would do that. I just was very insecure. I was trying to do all the things to try to make me feel adequate enough to actually help people and to feel like I was a doctor and to feel like I was capable of being the guy that people rely on to get better and to get well and to help them with their certain situations. It got a little crazy there, but over time, I was able to figure some things out. And because of this relentless, I guess, pursuit of clarity in what I was doing and how I was helping and what actually makes people healthy, I actually came across some things and then was able to put a lot of light bulbs together. So the first epiphany that we talked about here was those growth mindsets, right? So physically, via training and putting in the work, you can change your body for the better. You can change your skills for the better. You can improve wildly beyond your imagination if you're willing to put in the work. Mentally, same thing. If you're willing to study, if you're willing to connect the dots, however you have to connect them, if you're willing to work hard on your breadth of knowledge and understand how to connect the dots, then you can learn anything too. I think the first big thing that I had to understand was what was actually making people unhealthy. And I just tore through this and I said, there's got to be dots to connect. There's got to be things that really stand out as far as what's making everybody unhealthy. And I came to this conclusion that stress is the problem. Okay. Now, hear me out. Stress has three main forms. There's physical stress, there's chemical stress, and there's emotional stress. When most people think of stress, they think of the emotional stress. But physical stress and chemical stress can be very much a similar problem. And also, it can stress the nervous system in the same way. Once I realized that stress was the main issue here, then I began like devouring it, okay? And I came across a couple of videos that really explained it beautifully. And basically, with stress, physical, chemical, emotional stress, you have a micro component and you have a macro component. So a micro physical stressor might be something like chronic sitting, might be something like repetitive motion, like you're constantly doing the same thing, might be like inactivity, might be like overactivity, might be like even like beating yourself up in the gym with bad mechanics and those kind of things. So that would be like a micro physical stressor that builds up over time and sometimes can turn into a macro stressor. But a macro stressor of physical stress would be something like a car accident, major trauma, huge injury, torn ACL, whiplash of the neck that tears ligaments or something, major fall, you fall off of a building or something, that would be a macro stressor. That's kind of the idea of one of the causes of people's illness. It's stress, but I'm explaining the physical stressor, right? So a chemical stressor, let's go into a micro component first. A micro component of a chemical stressor could be terrible nutrition, chronic inflammatory nutrition situation, like toxicity. It could be like a micro poisoning that we're doing to ourselves. It could be like mold or Lyme's disease or something like that. That's kind of just like almost like a low grade chronic stressor. But maybe even like side effects of pharmaceuticals, that can be a micro stressor. Chronic inflammation from an old injury, that kind of a thing, which can lead to systemic inflammation or your diet and your the combination of all these inflammations creating a systemic inflammation, a leaky gut or something like that. So that would be like a chronic micro stressor, but then we got macro stressors too. So macro stressor chemically would be like a major toxicity, like a poisoning or something like that, or some sort of major acute issue, like even like food poisoning. But then let's think about emotional stressors as well. So all these stressors combine to really just crush our health, right? And a micro emotional stressor could be something like chronic abusive relationship, chronic beating yourself up, self-talk, those kind of things, family drama, or a passive-aggressive spouse, or even just things like traffic and school and those kind of things would be more like a micro stressor. So macro stressor would be like a death in the family, a lost loved one, major emotional hit, bankruptcy, divorce, those kind of things. That would be like a major macro stressor emotionally. So I realized that these are the things that make people sick. I made this connection that stress is at the root cause of almost all illness. Okay, almost all illness. So I was thinking about it and I was like, well, in 2024, I guess I made this realization maybe like 2020, maybe 2019 actually. I thought, well, is stress going away? I don't think it's going away, right? It's not, doesn't seem to be going anywhere. It only seems to be ramping up, right? I mean, you look at the mental health situation in this country and across the world, and stress ain't going away, right? So what do? Just try to not stress, try to somehow de-stress, somehow handle our stress. And I kept bashing my head against the wall trying to figure this out. Like, okay, well, if you got to obviously handle the individual stressors, and that's important, but what if we could build resilience to stress? What if we could build like a health bank account that would help buffer stress, physically, chemically, emotionally? Now you can get into the micro nuances of that, of how to do that for each one, but also just improving your health, having like health reserves is resilience. So it's resilience to stress that we need to focus on. That is what true health is resilience to stress, especially in this day and age. Okay. So it became pretty clear to me that that's where we need to focus our efforts. So building resilience to stress, how do we do that? How do we build those health reserves? And then that's where I came across these 4 pillars of health is how they were described to me. But I call them the EHCs, the elemental health categories, hence the name of my coaching company called Element X Health and Fitness. We'll talk about that more in a minute. But there was 4 categories, 4 pillars of health, 4 categories that seem to improve our health, and they can't really be neglected. Sometimes people can build one up and maybe let another one suffer a little bit. But those 4 pillars were how we eat, how we move, how we think, and how we recuperate from day-to-day life. Once I realized that those were the 4 things that have basically withstood eons, those have always been the things that humans have had to optimize to improve their health. So I became fascinated with how those things interlink and how do they best come together to help build that resilience, to help build up our health. And you do realize that they're all interconnected. But once you really come to the idea of, okay, stress is the problem, boom, epiphany. Resilience is the answer, boom. How do we get resilience? How do we build resilience? And I came across some videos where there were some really clever dudes explaining that chiropractic can help facilitate all 4 of those. So I was like, yeah, cool, chiropractic, let's go. Chiropractic can help you eat better there's a handful of different connections as far as how the adjustments can help get you from a sympathetic nervous system state, which is your fight or flight mode, down to a parasympathetic rest and digest, recover, grow, heal mode. And I was like, cool, I can dig that. And then I was like, okay, it helps you move. Obviously, that's the more obvious one. That's basically what we're doing with the adjustments, is facilitating motion and facilitating movement in the spine, which is helping ease tension in certain areas, helps ease nerve irritation, which then helps ease muscular spasm and I guess tonicity that just tends to ramp up when we're not out of alignment, but out of optimal positioning / have optimal mechanics. And when we think about the mechanics of the spine, it's really easy to jam up and kind of jack up the mechanics of the spine. So they constantly need either self-care or maintenance or chiropractic work or a number of different things that help ease the tension on the spine, especially because we're a seated culture and the average American sits like 10 to 13 hours a day. It's unbelievable. So once I realized that, I was like, okay, cool, chiropractic. And then it also helps with the way your brain works from a number of different ways. There's been some studies done on that. And then also it helps you recover because of that first thing that we talked about with the parasympathetic mode. So I was like, all right, sweet. Chiropractic's the answer, right? Yeah, heck yeah. And then I started realizing because of how much I leaned on it already. And I was like, well, what's the difference between chiropractic and the adjustments and facilitating motion and exercise? And I thought, of course there's differences, right? Chiropractic is something being done to you. Exercise is something you're doing. But via certain exercise modalities, you can achieve a lot of what chiropractic adjustments do, right? By mobilizing your spine, by doing mobility work, by strengthening certain areas that require stability so you allow other areas to be mobile, by mobilizing those areas so you can maintain stability. There's this interwoven relationship between mobility and stability that we're going to talk about too. But I realized that exercise was it. I'd been doing it the whole time. I had used it as a crutch when I was going through some tough emotional times. I had used it as a passionate hobby, I guess, because I got into bodybuilding and loved it and was excited. And sure, I love the aesthetics and that kind of thing and trying to improve the way my physique looks, but I also love the way that I felt after training. And while you're training, it feels awesome. But then you realize that you're maintaining strength, you're maintaining your ability to move, you're maintaining your physical resilience by hitting the weights and by strength training. But also, it can beat you up too, but you got to do it intelligently, right? So another thing that I'm going to focus on a lot with this podcast is intelligent strength training, balanced strength training, trying to do it in a manner that doesn't beat you up, where it's constructive instead of destructive. All right. So I realized that exercise was the key, but then I realized, well, what's the most important part of exercise? What if I was just to tell somebody to exercise, they would go do a million different things, right? And I started thinking, okay, well, we need to maintain our body's ability to move. And then we need to maintain our body's ability to do certain things, certain biomechanics against gravity. So what does that equate to? Strength, right? Strength is the answer. So I realized that strength training is so much more powerful than just building a gaudy, impressive looking physique. Strength and the muscle that you have to build, maintain, and kind of facilitate to build strength and to maintain strength is vitally critical. So once I realized that muscle was actually what was the main priority for building resilience to stress. Okay, so I know that was a bit of a stretch. So let me just break it down. So a couple of different things happened in my mind where I realized, okay, a muscle building, hypertrophic, anabolic environment facilitates this build up process. Now, of course, there's stipulations there. Some anabolic situations might not be that healthy when you're pharmaceutically enhanced with a bunch of drugs and those kind of things. So just, hang with me here. Versus a catabolic, breakdown, entropy, chaotic, everything's collapsing in on itself, atrophy type process. That's actually a perfect metaphor for health and for dis-ease or disease. That anabolism versus catabolism. Muscle is really what people need to focus on. And I started thinking, okay, that's awesome, but how do I communicate that? A lot of people don't care about building muscle. They don't realize the benefits, and I need to communicate those benefits, but how can I make it click for people that muscle is the key? I realized that, all these different things that contribute to muscle growth also usually contribute to health. So if you think about muscle hypertrophy, anabolism, it usually requires that we do something with our diet. Usually requires that we eat well. It usually requires a certain kind of eating, but all in all, you usually got to eat pretty decent if you want to stack on some muscle, unless you're like a 17-year-old kid with raging hormones that can just have McDonald's all day and put on muscle. Hey, I was there at one point. Muscle, basically, you have to eat right. You have to move better. You have to move weights to make muscle stick to you and stay on you. If you don't use it, you lose it when it comes to muscle. And then the thought process, as far as thinking better, as far as, the psychological component, well, you'll talk to a lot of people and realize how much strength training helps their mental health. And I'm one of them. And that was probably one of the first epiphanies that I made that I didn't realize until later, that I was actually really helping my mental health by hitting the weights. And there's been some studies that show it helps mental resilience and that kind of a thing, but there's more to be studied on that for sure. So obviously it's facilitating the way people think most of the time. Not everybody. There's always exceptions and stipulations and whatnot. But that was basically a big epiphany for me, but then also recuperation. So if you're going to build muscle, if you're going to stay in an anabolic kind of situation, you have to be able to rest and recover, and you have to be able to basically facilitate that recovery via nutrition and via mobility work and via a bunch of other modalities that help keep that environment robust and healthy and actually initiating kind of like a protein synthesis, which would be like a muscle building response. You have to recover, you have to sleep, you have to rest, So you have to figure out how to rest appropriately and time your rest and all of that. So it was one of those things where I was kind of blown away, where I was like, oh, that makes perfect sense. More of a muscle building environment actually is a really good metaphor for a health building environment too. So that tended to be what I focused on. I tend to really figure out, okay, I got to go from just adjusting spines to also holistically adjusting people's lifestyles. And I still am going to adjust spines, but I need to also address how people eat, how people move, how people think, how they recuperate. And it's interesting how that was what dawned on me. And all of a sudden, once I realized that, I thought right back to that Edison quote. And I said, holy cow, that's what he was saying. That's what the doctor of the future will do, is they will focus on those things, how people eat, how they move, how they think, how they recuperate. The cause and prevention of disease are those things, right? The stress is the cause. The resilience is the prevention. So it was like this weird epiphany, light bulb moment where I was like, this is it. This is it. So stepping into being a doctor of the future is kind of like what I feel I'm doing now. And I wish more doctors would consider these things. I mean, when's the last time you went to your medical doctor and they actually had talked about what you're eating? They talked about how you're moving. They recommended, they might say, oh yeah, diet and exercise, you need to handle those things. They don't give you any specifics. They don't give you any specificity as far as what you should be doing. And, if you're walking and maybe you go for a run here and there and you're eating some salads every now and then, they're probably like, man, whatever, it's fine. Just take these drugs, right? No, I'm just kidding. Anyways, I came up with this idea of this company called Element X, and there's a lot that went into it. And of course, I overthink everything. So I was really debating on, what's the most important factor? Okay, I think we need to get back to the basics. We need to understand how people are eating, moving, thinking, recuperating. Those are kind of elemental. Those are foundational level understandings that people need to develop and build and exercise to basically build their health and to understand what health actually is. But what's the most important one? Which one facilitates everything else? And that one I thought was exercise, movement. Okay. People need to eat better, move better, think better, and then recoup better. So I think if you're moving better and moving more, it's going to promote facilitation of all the other ones. So I came up with this idea of Element X, X kind of standing for exercise, but at the four corners of that X are the four EHCs, right? So how people eat, how they move, how they think. So basically nutrition, movement, psyche, psychology, and recuperation. Started to dissect those four categories. And by coming up with this name and just this whole idea, it all just started to come together. And I was like, yes, this is it. So now, Element X Health and Fitness Coaching is the company. And that's the main sponsor of this podcast. And what we're gonna talk about mostly is more exercise related interventions for pain and for just health building and those kind of things, but also just all things health. And I'm super excited to do it. And I really am starting to look at myself as more of a fitness facilitator. Okay. So even as a physician, as a chiropractic physician, I'm just facilitating movement. And then via that movement, a whole bunch of other things can improve, but they don't improve unless people put the work in. You know, a lot of people come to the chiropractor and they feel like they have to keep coming to the chiropractor and they have to do this. And there's so many myths about chiropractic, but it's because a lot of those chiropractors don't explain their limitations. They don't explain how you should have to have a lifestyle that coincides with a certain mission if you want to get better long-term from anything, especially a chronic low back issue, especially a neck issue, those kind of things. Now, of course, if somebody comes in with a little acute neck pain to see me, I'm not going to talk to them about their diet and, you know, their thought processes and all. I'm just going to help them get through that situation. But to get better long-term and to not need the chiropractor, to not need your doctor, don't get me wrong, everybody should be under some sort of medical care and take all the necessary precautions. And I'll have a disclaimer in here somewhere, I'm sure, throughout all these episodes, because, you know, it gets people get a little weird when it comes to health information and health advice. Okay. So this is never going to be, you know, health advice that takes the place of your doctors. Okay. But we need to address those 4 categories. And if I can encourage fitness type behaviors, it's going to facilitate all of those categories. So basically, you know, that's the journey. There were some main epiphanies here, you know, where the growth mindsets were huge. Okay. The physical growth mindset, then the mental growth mindset. And then the epiphany that stress was the main contributor to people's illness in a number of different categories: physical, chemical, emotional, macro, micro components, right? Resilience was the way to build, well, resilience is the key to buffering and dealing with the stress and improving your body's ability to handle the stress, because it ain't going away. It ain't going away, that's for sure. And then the last thing was that, okay, what builds resilience? Those 4 categories, those elemental health categories. And what do I think is the most important one? It's exercise. And what do I think is the most important exercise? It's strength training. Okay. It's strength training and promoting an anabolic muscle building lifestyle. Not that you need to be a bodybuilder, not that you even need to have sculpted muscle on your body, but living a life where you're almost constantly trying to kind of build muscle is going to benefit you so many different ways, from a standpoint of reversing and even staving off chronic disease, which is what's, you know, most of our healthcare dollars are spent on chronic disease, chronic lifestyle preventable illness. Chronic lifestyle preventable illness is chronic disease. Okay. Building muscle and staying in a exercising of that muscle state where you're constantly trying to use it or you're going to lose it type of thing. That is huge for staving off chronic disease. And I've seen it benefit me. I've seen it benefit tons of patients, clients. And I'm telling you what, when you see some of these people in the gym that have been exercising for 30, 40 years and been doing it in a controlled, balanced manner, they look incredible. I've seen people in the gym that are in their 60s that I wouldn't have thought they were beyond their mid 40s. And of course, everybody's banged up. By the time we get to, you know, retirement age, everybody's got some injuries that they've accumulated, probably some arthritis and that kind of a thing. But I'm telling you, the best way to maximize your quality of life, your ability to move, minimizing the chance of chronic disease, it's by living kind of a anabolic muscle building type of lifestyle, emphasizing that muscle is important, and it will facilitate the other 4 categories by living in that state or in somewhat of an effort towards trying to build muscle, maintain muscle. Okay. Basically, you know, that was the main epiphanies that have gotten me to a place where I'm like, okay, we're shifting from adjusting spines to now we're adjusting lifestyles, and I got to start putting information out. I got to start helping people on a number of different platforms, a number of different ways. Health is hard. Health is hard. Okay. This day and age, with all the stressors that are coming at us from a number of different angles, you can understand that health is hard to maintain in this day and age. We got the physical stressors, the chemical stressors, and the emotional stressors coming at us from all angles all the time. So that's going to pretty much do it for this episode. This is the introductory episode. I hope it comes out all right. I might have to redo it 5 freaking times because I'm such a perfectionist, but we might just put it out. We might just put it out and get better as we go. I appreciate you tuning in. Remember, health is hard, but we can tackle these challenges together. I'm here for you. We'll see you soon.
Hey, it's Dr. Matt. Are you looking to make some moves towards better health and fitness and do so in an effective, efficient, and sustainable way? I'm excited to introduce to you Element X Personal Transformations, my premium online fitness coaching program designed to help you crush whatever fitness goals you may have, whether it's slapping on some muscle, building some strength, actually losing that stubborn body fat that keeps coming and going, recover from a nagging injury, or all the above. Now, what sets the EXPT program apart is its personalized approach. You'll start with a 3-call intro process with me, Dr. Matt, personally, each lasting 30 to 45 minutes. During these calls, we'll dive deep into your unique needs, preferences, goals, and whatever else you want to talk about to create a customized fitness situation that's perfect for you. No more guesswork. No more one-size-fits-all approaches. With EXPT, you'll receive expert guidance, support, and accountability every step of the way. I've done my best to create a program that puts a chiropractor, physical therapist, and personal trainer in your pocket, or at least on standby. We'll work together to optimize your nutrition, training, recovery, and mindset to help you achieve sustainable, life-changing results. So if you're ready to do all that, head to the link in the description, complete the quick 5-minute coaching application. Not everybody's a candidate, but this quick application gives me all the details to let you know up front if it's a match or not. But don't wait, spots are filling up, and I can only handle so many clients at a time because of the detailed, personalized approach. So I hope to chat with you soon. All right, that's a wrap for today's episode of the Health is Hard podcast. I hope you found some valuable tips to help you on your journey to a healthier, more fit, more resilient version of you. Remember, building a stronger, healthier you takes time, and I'm here to support you every step of the way. If you enjoyed today's episode, please subscribe, leave a review, and share it with a friend who could benefit from the goods that were in this one. Be sure to check out the show notes for resources and a special offer from our sponsor, Element X Health and Fitness. As a listener, you can get my free 83-page Chiro Companion Mobility Guide when you visit elementxhfc.com. That's Element X, H as in health, F as in fitness, C as in culture. If you have questions, suggestions, or just want to connect, find me, Dr. Matt, on Instagram and TikTok at Dr. E Health, DRE Health, and Twitter at DREX Health. Let's keep this conversation going. Thank you for being part of the health and fitness culture we're building together. Keep putting in the work, stay consistent, and cheers to making health a little less hard today.